Jaw fractures are a fairly common occurrence in veterinary medicine. Generally, it's traumatic in origin, hit by a car, falling, hit by a baseball bat, or something like that, and they can be quite painful, although a lot of animals won't show signs of oral pain. There are several options for treating jaw fractures in dogs and cats. These include plates, external fixators, pins, wiring, both interosseous and interdental, acrylic splints, and bonding of the canine teeth together. Here is a picture of a cat whose jaw was fixed with an external fixator. As you can see, the appliance is very large and uncomfortable. Here is a dental radiograph of a canine patient with an external fixator in place. The pins are going right through the teeth. In addition, this is the third time this jaw has been fixed elsewhere. The reason that this is not working is that the area is infected, as evidenced by the dark areas. This is a pathologic fracture that needs further therapy. Another common method for jaw fracture fixation is a bone plate. Again, as you can see in this radiograph, the screws are placed right through the tooth roots, thus causing damage. While external fixators and plates can be effective means of reducing fractures, unfortunately, they are quite invasive and require a second surgery to remove them later on. In addition, as you can see, the patient will be quite uncomfortable with an external fixator during the healing phase. Here at Southern California Veterinary Dental Specialties, we typically select oral acrylic splints for fracture fixation. Acrylic splints have numerous advantages over other fracture fixation methods. These include immediate return to function, no invasiveness, and finally, and possibly most importantly, when we remove the device, we do not have to go into the dog's body at all. We simply have to cut the acrylic and remove it from the teeth. Therefore, a second surgery is not required, however anesthesia is. The majority, but not all, jaw fractures can be fixed with an acrylic splint. If the fracture is not amenable to an acrylic splint, we will typically use interosseous wires. Interosseous wires are very flexible with their placement, and by using our dental radiographs, we can almost always avoid tooth roots or other vital structures. In general, these are removed in 2 months after healing has taken place. However, in some fractures, we may leave them for the life of the pet. The final option when fixing fractured jaws is to bond the canine teeth together. This is in essence wiring the jaw shut. We typically do this when we have a fracture that is far back on the mandible and we cannot otherwise fixate it directly. The jaws are placed in occlusion and the canines bonded together. In some cases, we may place a feeding tube in order to provide the nutrients easily. However, in most cases, this is not necessary. There can also be a pathologic fracture. That occurs secondary to some type of disease, typically a periodontal disease, but also possibly cancer. These are more common in older, small breed dogs. If you have an older small breed dog with a jaw fracture, especially if it's the back part of the jaw, you should suspect a pathologic fracture. If you suspect that your dog has a pathologic fracture, please view the separate video on this subject.